Welcome to this first aid video about dealing with a broken finger or thumb. Please subscribe to this channel by clicking the button below, and if you would like to be informed of new videos in this series, please click on the bell button below this video. You might want to pause the video now to grab a pen and paper and perhaps a drink. I hope you enjoy the video.
Do you think you have a broken finger? Despite what Dr. Google and Sharon from Facebook says, a broken finger can be treated, and medical treatment may certainly be necessary for your finger to heal properly. So, get medical advice as soon as possible. Many people think a fracture is a lesser injury than a break. The truth is, a broken bone is also known as a fracture. They are both the same thing. So, how do you check to see if you have a broken finger or thumb? Unless the bone is sticking out through your skin or bent sideways at an angle, it can be very difficult to tell if a finger is broken, dislocated, or badly sprained. Unless, of course, you have X-ray eyes. You haven't, so you'll probably need an X-ray. In the UK, we have 3 options or routes to go down. If you have had an injury and your finger or thumb is swollen, painful, and bruised, or stiff or difficult to move, you can call a free NHS number, 111, and discuss your finger or thumb to gain clinical advice. Alternatively, visit your local urgent treatment centre. However, if your finger or thumb is pointing at an odd angle, turning blue, or feels numb, cut and you can see bone through it, cut and there's bone sticking out, immediate action is certainly required, and you must go to A&E. Urgent treatment centres, also called UTCs, are GP-led and open at least 12 hours a day, all week. They offer appointments that can be booked through 111, or you can go through a GP referral method. UTCs are fully equipped to diagnose and deal with many of the most common issues that people generally attend A&E for, but without that long wait. This is what happens in a clinic or hospital. You will be seen by a doctor or nurse who will assess your injury and might attempt to straighten your finger, but don't worry. They'll inject a local anesthetic to numb the pain, splint your finger, or put a cast around it. They may even strap it to another finger to keep it in position. Also, if there is a cut, they may give you a tetanus injection or prescribe antibiotics to prevent infection. If it is a complicated break, such as broken in many places, or your nerves are damaged, you may need to undergo surgery. The doctor or nurse may advise arranging a follow-up appointment to check how your finger or thumb is healing.
In the meantime, before you head off to have your finger assessed, you might need to reduce any pain and swelling as well as protecting your injury. Follow these simple steps. Try not to move the injured finger or thumb. If you think it would help, tape it to the next finger. Raise your hand above your heart to help reduce swelling. You could rest it on a cushion. Apply an ice pack or even a bag of frozen peas, wrapped in a towel, for about 15 to 20 minutes. Do this every 2 to 3 hours to help reduce swelling. If you have a bleeding cut, cover it with a clean dressing. Take a painkiller, such as paracetamol. It is important that you do not take ibuprofen until a doctor has confirmed the status of your finger and it is safe for you to do so. Take off any rings from your affected hand if possible without causing more pain and injury.
A common question is, how long does it take to recover from a broken finger or thumb? Expect anywhere between 2 weeks and 2 months, even longer. It all depends on age, fitness, usage, and of course the seriousness of the actual break. Be mindful that after it has healed, it still may be a good 3 to 4 months before full strength returns to your hand, leading to full recovery. Once it has healed, some good old-fashioned homemade physiotherapy will be very useful. This means using your finger or thumb as normal, but in addition, keep moving it to stop it getting stiff. Ask the doctor or nurse to show you some gentle hand exercises. It is important that you seek advice from your doctor as to when you can return to activities such as contact sports or other things that you do, which will put a lot of strain on your fingers. You don't need to go back to the hospital or the urgent treatment center if you have concerns such as being worried that the broken finger or thumb is not healing properly, that the pain and swelling have not started to ease after a few days. It still hurts when you use the finger or thumb after the cast or strapping has been removed.
We've come to the end of this video and I hoped you found it useful. If you would like to see more related videos, please click on the subscribe button, and to receive notifications of new videos, please click on the bell button. Thank you for watching.